Hello, my name is Lola Enifeni and I'm the Fetal Monitoring Midwife for the Trust. Today I'll be speaking to you about fetal monitoring and what this entails. During labour, various assessments are made to ensure labour is progressing normally and your baby is not experiencing any difficulties. One such assessment is listening to the baby's heartbeat. Most babies go through labour and are born without any problems. But there are a few babies who have difficulties, and the best way of finding out when a baby is having any difficulty is to listen to their heartbeat regularly during labour. During labour, when the womb contracts, the blood does not flow as freely through to the placenta and through to the baby, and this may cause reduction of oxygen supply. This is completely normal and most babies can adjust without any problems. If your baby is having any difficulties in adjusting, this may be reflected in the pattern of the heartbeat. Your baby's heartbeat may be monitored in two ways. So the first way is by intermittent monitoring. The second way is via continuous monitoring. Intermittent monitoring is the recommended method of monitoring for women who have had an uncomplicated pregnancy. So what do we use to monitor for intermittent monitoring? We use two main equipments. We have the pinard stethoscope, which is either a plastic or metal trumpet-shaped object. It enables the midwife to hear your baby's heartbeat by holding it against your abdomen. The second method is a Doppler, or sometimes called a sonic aid, which is a small handheld device also placed on your abdomen. It magnifies the sound of your baby's heartbeat, enabling the midwife to hear your baby's heartbeat. And you can also hear your baby's heartbeat at the same time. Before starting to monitor your baby, the midwife will assess your pulse as well as the baby's heartbeat to establish the difference between the two. When you're in active labour, so this is regular contractions and 4 centimeters cervical dilatation, your midwife will listen to your baby's heartbeat every 15 minutes. And when you're in the second stage of labour, so when your cervix is 10 centimeters, or when you feel like pushing your baby, your midwife will listen to your baby's heartbeat every 5 minutes or after every contractions. So what are the benefits of intermittent monitoring? It allows you to move around as you like and you will not be restricted into one position. You can get into various positions as you please. You can use the pool for labour, and we can continue monitoring intermittently. When pregnancy is straightforward, intermittent monitoring reduces the chances of unnecessary intervention. If there is a concern about your baby's heartbeat, continuous electronic heart monitoring is advised in such cases. If you're at home or you're at the birth centre, this means you need to be transferred into hospital to the labour ward. So what is continuous electronic fetal monitoring? This records your baby's heartbeat as a pattern on a piece of graph paper, which is called cardiotocography, shortened for CTG, or as a trace. The midwife and the doctor will interpret the trace to get an idea of how your baby is coping with labour. They will be able to explain their findings to you. Continuous electronic fetal monitoring can also be done in two ways. One is by monitoring by fastening 2 devices around your abdomen. So one of the devices monitors your baby's heartbeat, whilst the second device monitors the frequency of your contractions and your pulse. The other device is called a fetal scalp electrode, which is shortened as FSC. It's on the other end of a very small wire which is passed up through the vagina and fastened onto the baby's head. And FSC does not harm the baby, although you may notice a small graze on the baby's head after birth. The electrode can then be picked up the signals on the baby's heartbeat more easily because it's directly attached to the baby. The electrode stays in place until the baby is born. Being attached to the monitor for continuous monitoring can limit your ability to move around. However, we do have some wireless machines which allows you to move around and can also be used with the pool and underwater whilst you're having continuous monitoring. Understanding how your baby is coping with labour can help the midwives and the doctors looking after you make decisions with you about the best and safest care for you and your baby. Other indications that your baby is coping well in labour includes your baby's movements. So we do still expect you to still be feeling your baby's movements just as normal. And if there's any reduction in your baby's movements, you should still alert your midwife or your doctor. If you have any concerns or any questions about monitoring your baby during labour, please ask your healthcare professionals or ask your midwife.